walls up. Starting to look like it's actual house.
Coming together.
Cabin. Yeah. Hopefully get all the material we went and got yesterday all unloaded today. Need a crane though. The beam on that just going to run across Todd's upper part of his garage is 42 feet long.
Pretty good span.
Yeah. I don't think a bunch of us are going to lift it.
Where's it coming from?
Albany Falls ordered it. I'm not sure which mill is cutting it. So
You building something?
I'm helping Todd build it.
Oh,
Priest like.
fun.
We took the week off. This is what I did. And then my laptop that I was so proud of. Guess what I didn't bring?
The laptop you're so proud of?
I get in there and I go, thank you. I didn't turn my computer on. I go, well, I don't have a computer. It's at home, so I guess we work with it.
Oh,
It's just shouldn't come in from the lake. We should accommodate 8 people meeting if it's not.
yeah, I sent it to Ann asking what dates it is, because I didn't know that. I just thought if I could find a place, then she can help with the details.
We've got more than one conference room that could accommodate 8. I didn't see the dates, but
General fund details.
All right. Ann, are we ready to go up there? All right. Well, looks like it's that time, so we can go ahead and get started. Today's agenda, which was attached to the Outlook calendar invite, has an agenda review, health officer updates, the dashboards, GSI report, open discussion, where we can discuss any of the action items that's from last week. Our next meeting, and then the end of the adjournment. Anything anyone would like me to add or to the agenda? All right. Well, then I will give it to Steve first. Dr. Lutz is just joining us, so we'll let Steve go first to kind of go over the date or the data. Yeah.
All right. Thanks, Vanessa. So last week, really going through it for new cases, we had 649, which was 48 more than the previous week. Daily average was at 93. When we fit a trend line to that, it's pretty much flat between the 2 weeks. There was that one day where we had a large spike, but otherwise it's relatively flat trend at the moment. The age group with the highest percentage of cases remains that 20 to 29, keeping it at about a quarter of all cases. All other groups are similar between the 2 weeks. Same when it comes to race. We're still dealing with a fair backlog in data entry. So right now in the reporting, you see a lot of other or unknown when it comes to race, and that just has to do with the data entry and backlog that we have. Our rate per 100,000 of newly diagnosed cases last week was 209.6, not meeting the goal of 25, but again, it's relatively flat, as well as our epi-link curve with about 55% epi-linked. Previous week was the same. Unfortunately, we had 37 new hospitalizations last week. That's up from 23 the previous, and it spans pretty much all adult age groups except for those under 30. So we have 1 in their 30s, an individual in their 40s, 5 individuals in their 50s, 9 in their 60s, 7 in the 70s, and 12 in their 80s. Currently hospitalized are 44 individuals. Also, unfortunately, the number of deaths rose last week. We had 13 new deaths. 1 individual in their 60s, 4 in their 70s, 5 individuals in their 80s, and 3 in their 90s. The previous week, we had 5 deaths. For testing, the number of individuals tested for each new case was 9.1, with an average daily testing of 702, which again is just kind of a flat trend. It's about 1 more than last week. For the healthcare system readiness, the percent of our licensed beds occupied by patients is 63, which is meeting our goal of less than 80%. Our licensed beds occupied by suspected and confirmed COVID-19 cases is at 83. And that is about 5.4% of all licensed beds, which is meeting our goal of less than 10%. For case and contact investigations, we investigated 178 cases internally, which is just showing that our internal capacity is increasing. We also brought on several new case investigators this week, as well as we're ramping up that contract. Our contacts investigated last week went up significantly to 297. Cases reached within 24 hours was 83%, which still meets our goal. Contacts reached within 48 hours was 97%, which is great. For our care coordination branch, the number of cases or households to date that the care coordination branch is working with is 198. That's an increase of 54 households from the previous week. We currently have 87 cases that are open, and we closed 30 the previous week. In the food security department, the number of new EBT applications through DSHS went up slightly to 446 from 434 last week. The jobless claims data puts us at 1,927 new claims for joblessness, and that's about the same as the previous week. Childcare remains the same. The previous week, 25% of childcare or family care centers are closed. For the birth to 5-year-old programs closed, we have 16. 5 to 12-year-olds, we have 81. And vacancies currently are at 1,128. And then the final new addition to this, as I keep adding things, we do have a group of business technical advisors that are working with business communities where there are issues or cases that are confirmed. Through May 27th through July 31st, they have done 690 consultations with businesses. Total completed through this past week was 304 consultations that they completed. They had only done 48 the previous week, but that makes sense because we just brought them on 2 weeks ago. So really working closely with the businesses now. That concludes my piece.
Any questions for Steve on the data? Okay. All right. Dr. Lutz.
Good morning.
Good morning.
The only two comments I would make with respect to Steve's data is to put the hospitalization in context. Those were just Spokane residents. There are actually currently 70 plus individuals in our 4 hospitals. And if I combine that with Kootenai, we have 92 hospitalizations. So that's obviously a significant increase in what we've seen historically. The other thing is that, as Steve pointed out, our trends are, cautiously, optimistically flattening, which is good to see. That's consistent with the modeling reports that have come out the last 2 weeks from Institute of Disease Modeling, where they have seen a little bit of a flattening, which is encouraging. That just means that what we're recommending, people may be actually following through with. So we need to keep on keeping on to really start to see a decrease. So those are the only 2 comments I have about the data. Obviously, yesterday, I did, as everybody seems to have found out, I did provide recommendations to school districts across the county. That was ideally to be something to be discussed further on Wednesday with the superintendents, but it obviously was sent out to the media, and so everybody is well aware of that. I'm expecting to see more guidance coming out from Department of Health today. I saw the preliminary draft reports over the weekend, and I expect to have those today to be able to deal and talk with superintendents about that, about the specifics tomorrow. So that's it. Questions for me? Hearing none.
Okay.
Good.
All right. Alicia, anything for Greater Spokane?
Not much new to report this week. We're in process on the grants. I think my biggest encouragement there is just to continue to help your businesses and nonprofits and your networks be aware of the opportunity and apply. We're hearing a lot around fatigue application fatigue, and concerns around, is it for sure a grant versus a loan? So just your help continuing to, through your networks, help connect nonprofits and small businesses to the opportunity. That's moving along. I think the only other thing I'd say is that we, as you know, are rolling out the consumer confidence campaign to spread kindness, not COVID. And we've had a great set of conversations here this last week with our partners to the north counties of us in the Tri-County Economic Development area. They're really interested in the ability to potentially build off of that campaign. They're struggling quite a bit with the huge number of people from Spokane County who head north over the weekend. So like thinking about how we can partner on that to extend the messages around masking and social distancing, et cetera, to their counties, and particularly the tools that their businesses throughout that Tri-County area are desperate for as they work to meet the guidelines and guidance as well. So those are probably the two main things this week.
Thank you. I know here at the Health District, the Facebook Live talking about the grant process was one of the highest watched numbers, from the Facebook Live. We had some of the largest numbers of folks tuning in, and then we've pushed out to our partners in the nonprofit world who are looking for some funding for the work that they do for families. So thank you. Any questions for Alicia and GSI? Oh, looks like
I have a question.
Yep.
This is Doug with the City of Medical Lake. On the housing, the $100 million that Commerce just came out with, Alicia, for rental assistance, is that going through is GSI participating in that?
We are not.
Okay, never mind.
But I can help you get connected with, if you have questions, certainly get connected to the right folks. But we, as an organization, haven't been involved in any of the housing pieces. Okay. Most of that is worked directly through cities and counties. For the most part.
It'd really be helpful. I've read through it, and it's a little bit of a read. It'd be helpful if there was some sort of concise something that we could all put on our Facebook pages that our residents could actually not get intimidated by. Because if you read through the announcement that came out, it's a little difficult to follow, in my opinion. So that's all I was looking for. And I'll contact Commerce and see if they have something a little more concise and simpler to put on that we can get public notice out. So that was it.
Doug, can I help answer that question? This is Commissioner
Yes.
Cuny.
Yes.
We just turned in the application on Friday for $5.9 million of that for Spokane County. And so it'll be coming through Spokane County through our Community Services Department. So
Okay.
I would probably have you contact Tim Crowley. He would,
Okay.
with our Community Services, he'd be the one to work with on that.
I will do that. I know Tim, and that's awesome. Thank you.
Perfect. Thanks.
Any other questions for Alicia? All right. Well, last week at the meeting, there was a request that we add an open discussion item, to talk about different actions or just open discussion about the response. So if anyone has anything, this would be the time to start bringing that up.
Don't have anything today, Amelia. Thank you, though.
All right. Thanks, Sarah.
Amelia, it's Wes. I have a general question maybe for the health district. As we look at indicators, I probably ask this question every week, by the way. Are there actions that the cities could be taking, should be taking now that would have a beneficial impact on our trend lines?
I think we can all respond to that. I think a lot of it is more of the same. Just really reinforcing, we've seen the number of folks wearing masks go up from our just, initial observation study, but I think it's really just more of the same and reinforcing the behaviors. Dr. Lutz or Steve, any?
Yeah, Wes, I think the only other thing I might add is that I was talking with a friend last night. She tends to go riding her bike in the afternoons and sort of early evenings on the west side of town. And she says it's not uncommon for her when she's riding by some of the taverns and some of the places that they're probably a little bit more than 50% and maybe not quite as following all the guidance as they should. We certainly don't have staff to be going out and policing all of the places. So it may be worthwhile that, again, as you have staff, as you have SPD sort of around and doing their rounds, just sort of take a drive by and take a look. And if it looks like it's a little bit more, just give them a friendly reminder that, there is guidance that they need to be following and it's all collectively working together.
Yeah, we'll continue to emphasize that. That's a great point.
And I guess, Wes, the other thing is I appreciate both Garrett and Doug working on some of the signage and some of the activities around the parks, golf courses, things of that sort. So I think that messaging is working and continuing to enforce that or to encourage that. And then again, I would encourage that those and other municipalities do likewise. Because we know that parks are great places for people to recreate. They're also great places for people to congregate. And the first is great and the latter is not.
Yeah, we've actually, we've got just a little bit of budget capacity due to, things that programs we're not offering in the parks. We're able to, the plan is to put some, few people on as ambassadors, just to be at a park to go remind people that might be congregating too tightly and answer questions, et cetera. We're hoping that we can roll that out. And then kind of along with that, we also work with Lime. I'm sure you were aware of that, to kind of keep the Lime scooters in the transportation commuting mode rather than the let's congregate and screw around in the park mode.
Amelia?
Yeah.
I was just gonna to kind of pick up on that, and I see Shelly's Quinn's on the call today as well. She and I were chatting yesterday as we're thinking about the work up in our Tri-County area, and a lot of what we're hearing is, and we had this conversation a few meetings ago as well, is just how so we may be doing better when we're here in Spokane County, but as we as people vacate Spokane County to either the counties to the north that are in a further phase or across the border to Idaho. They're quickly dumping those behaviors for what's occurring in those other counties. And so part of our Shelley and I's conversation yesterday, and this is a conversation we certainly need to have with the commissioners, but should we be thinking about some strategic marketing placement in a few of these areas around our county? But not just in our county, because it seems that we're oftentimes in our work, we talk about how we don't really think about the border, or we don't think about the county line. But in the case of what we're seeing right now, people are very much taking the county line and division to heart as we think about tackling the public health side of things. And then that's part of what we're seeing come back. And for our county partners to the north, that's extremely challenging for them because they have having less resources, and the number of people they see at their lakes and in their outdoor recreation areas that are congregating in large groups and those kinds of things is pretty significant. So just something to kind of think about. I don't have a full solution, but Shelley and I were just kind of brainstorming. Is there some ways to be thinking strategically about extending some of the messages and the tools that we need as a community to respond?
Yeah.
Alicia, this is Bob. I mean, I think it's a great idea. I also think there's a real intentionality behind people who are heading north and heading east. I mean, case in point, I had a nice backhanded email sent to my wife last night from a neighbor talking about, shutting down schools. And we love going to Idaho. We're actually over at the lake for the next couple of weeks where we don't have to follow the restrictions that are in Washington. And so I think, there's an intentional practice. We go north because we go north, and we go east because we go east, and things are different. So I think the messaging, there's a deliberate reason why people go where they go. and they do what they do. So I think messaging right on, but I think, as I said, there's a population that doesn't like what's happening here and goes elsewhere because they feel they don't have to practice those same behaviors.
Agreed.
And this is Shelley. But Bob, I think you just reinforced what Alicia and I were chatting about, is that those counties which are under-resourced even more than Spokane County are bearing the brunt of Spokane County residents going north and not being good neighbors. So is there a way that we as Spokane County can help extend that message of spread kindness, not COVID, to those outlying areas that we know are hotspots for Spokane residents? Loon Lake, Deer Lake, Diamond Lake, Priest Lake. Yeah, so just I think we need to be thinking about the fact that the counties surrounding us are bearing the consequences of people not wanting to follow the rules in Spokane County.
Yeah, no, I think, we know, but it's kind of.
Shelley, the rules aren't Spokane County. I
Right,
mean, the rules are statewide.
right,
So it's, again,
Correct, but they are statewide, but we are more restrictive in Spokane County because we're in a different phase than than Idaho, for example.
right. Okay, Ann, I thought I saw, did someone type in a question?
No.
Oh, okay. Any other questions or comments?
I would just add to Dr. Lutz's comment. I think even some of the smaller communities surrounding the city of Spokane, I think people are doing some of the same things. We struggle with our Waterfront Park, which is very, very popular. And we've tried some things and had kind of a mini revolt. And so I think it extends within the county to some of the smaller jurisdictions. I think they go there and they think it's a small jurisdiction. It's not going to happen there. And I'm pretty sure it's going to happen here. So
Right.
It's not even just other counties. It's our own smaller municipalities. I think it happens.
Yeah.
Intentionally.
Any other items for open discussion? Okay. I think so we are not going to have this meeting on the next Tuesday. So the next meeting will actually be on the 18th. So make sure you update your calendars for that. And with that, if there's nothing else, I think we're ready to.
I'm sorry, this is Shelley. I couldn't get myself off mute. I do have one more question for Bob. And maybe you don't know the answer to this, but when we think about this next school year, what are you looking for kids to be able to go back at least part-time?
I think that's the guidance that Bob mentioned we're waiting on from DOH. And from the governor. We were supposed to have that at the end of last week, and that has not come out yet.
So it will come down from the governor as to when students can go back.
It's my understanding, Shelley, Department of Health is going to provide guidance. It's the intention, or it's the hope that guidance is then incorporated into OSPI's recommendations and requirements for the school district. Again, as I've pointed out, public health has no authority over schools. And so we make strong recommendations. And, then if outbreaks occur, we end up having to do what we have to do. I think the concerns that many of us have across the state with our current case counts and our incidence rate is that the disruption of starting school in person and then having to shut down school really quickly when we see cases is probably more problematic than starting off slowly. But certainly the incidence rate is going to be a key metric going forward, as well as some others such as looking at hospitals and things of that sort, positive rates for testing. But the incidence rate that you'll see what we have, as Steve reported, 209 is a far reach from what we have seen sort of successfully implemented in other countries where they've attempted to open up schools in person.
Okay, any other questions? Okay, so we will see everyone on the 18th. And the numbers will still be updated on the website, so you can check there if you have questions or need an update. So thank you, everyone, and have a great rest of the week.
Thank you.
Oh, yeah, I used to. You said your next 8.
There were a few more people at Albany Falls where we were buying lumber and such yesterday wearing masks. Yeah, oh, I definitely think. And they had their little 6-foot things. Yeah, I definitely think it's picked up. But I think, again, our point